So I have Christina, who is a 40 years old female, Sundanese female who presented to RSUD Cibinong last night with stabbing pain in the lower left abdomen, namely kidney pain, and the duration of 10 minutes. She has story of pain that is pain in the lower left abdomen and accompanied by nausea and vomiting. She said that the pain started 2 days ago while she working in the day shift and have gradually gotten worse. The pain is an 8 out of 10. It is also worse upon standing and moving. And for the review organ system, she has straight hair, is black and difficult to pull out. For neck is no granular enlargement. For eyes, with white sclera, not sunken, pupil is Sekar, cornea and iris are not cataract and inflammation. For ears, right and left symmetrical shape, no tenderness, no assertive device. For nose, symmetrical left and right nostril, good smell, no sinus, no tenderness. And for mouth and tongue, the lip mucosa is dry, pale, the tongue is not tremor and clean, the teeth are not carious, and tonsil size is normal. For her heart, symmetrical shape, no visible pulsation ictus cordis, no cyanosis. On palpation, ictus cordis was palpable at IGS 5. There was no swelling. On percussion examination of resonant heart sounds and on auscultation of loop heart sounds, there were no addition sounds. And for abdomen, bowel sounds were heard 15 over minutes. There were no lesions. Symmetrical shape, there was a tympanic sound. When on palpation, there was tenderness in the lower left abdomen on a scale of 8. For genitalia and anus, is clean, no lesions, no catheter, no hemorrhoid. For extremities, installed infusion in the left hand infusion, RL 20 drops over minute. Her past medical history does include psychology and social history. Are the patient said she was patient and accepted her illness and left her healing to God. Both before and after the illness, the patient continued to perform his 5 daily prayers, and the patient has a good relationship with her family. For medication history, the patient said at the age of 28, patient often experience symptoms of nausea, vomiting, and pain in the abdomen. The client improved after being given treatment. There is oral medication and injection treatment. For oral medication, there are allopurinol, antacida syrup, and indapamide. For injection treatment, there are paracetamol, RL, omeprazole, metoclopramide. For sexual history, the patient can communicate with her partner and have sex 1 or 3 times a week. The details from the physical examination for general condition, consciousness is complementis. For nutritional status, for age is 152 centimeters, and for weight is 53 kilograms. For vital signs, blood pressure is normal, 110 over 90. For pulse is 80 over minute. Temperature is 37 degrees Celsius, and for respiration is 17 over minute. And I have supporting examination. There is laboratory examination. There are ureum, creatinine, kalium, uric acid, fast glucose, and HB. And then I have some diagnoses. There are hypervolemia, acute pain, and nutrition deficit. And I have some planning for the diagnosis. For the first diagnosis, there are monitor the result of laboratory tests, record intake and output, and calculate 24 hours fluid balance, and then collaboration of diuretics. And for the second diagnosis, there are identify the location, characteristic, duration, frequency, quality, scale, and intensity of pain, and then explain pain relief strategies, teach non-pharmacological techniques to reduce the pain, collaborative administration of analgesics. For the third diagnosis, there are identify eating patterns, and then monitor laboratory result, set the monitor time interval according to the patient condition, and then explain the purpose and procedure of monitoring.